Bob Huebscher, and this is the Gaining Perspective podcast, where we bring you insightful conversations with some of the top thought leaders in the investment advisor profession and investment management industry. I am the founder of Advisor Perspectives and a vice chairman of Vetify. The world population is aging rapidly. 65 million people over the age of 65 will live in the US by 2030. The disparity between the length of time a person lives, their lifespan, and how long they are in good health and can function well, their health span, is widening. And as a result, a significant portion of aging adults are spending longer portions of their lives in poor health as they struggle to pay for caregiving assistance. This grim trend is the reason why 73% of aging adults in the US cite sickness as their main concern. They want to improve their health to protect their retirement, but surprisingly, this is a highly underserved market. Many aging adults have savings, income, and wealth transfer solutions, but due to a broken insurance market and old paradigms, very few can get solutions to hedge against disability and its wealth draining consequences. In 2020, the NeverStop platform, which we will learn about today, was launched to allow insurers to help their policyholders live longer and better by protecting them from disability and its financial consequences. My guest, Larry Nisenson, is the Chief Growth Officer for Assured Allies. So, Larry, I'm going to have you start out by telling me about your career path, what led you to Assured Allies, and your role there.
First of all, thanks for having me, Bob. I am unbelievably excited to chat with you today and to your audience about what I would call the single largest problem affecting the U.S. economy on what's to come. And I say what's to come because we're going to talk about that in a little bit. But I had what I would describe as probably an atypical path into the insurance business. I've been on the carrier side of the insurance equation for almost 30 years. And started off as a restaurant owner, which I'm sure you could see the direct correlation from one to the other. It's quite an obvious path. I actually broke in to the business in the late 90s, having sold a restaurant and having the chance to evaluate what it is I wanted to do. I was a stockbroker. So as I started out, I became a financial advisor. And what I realized quickly, in deference to your audience, is I loved the industry, but I was terrible at meeting with clients and explaining to them the importance of financial planning. It wasn't what I was best at. And I was blessed enough to find my way over to the insurance carrier side and really have spent 30 years building products on the insurance space that drive innovation, bringing distribution and product and pricing all to the table together to create products that don't just look good on paper, but more importantly, help financial advisors and their clients figure out how to solve what I call the aging dilemma. And I've had the pleasure of doing it for many companies. Most recently, before joining Assured Allies, I was the chief commercial officer for Genworth Financial and had responsibility over product, marketing, brand, sales, and distribution.
So tell me about Assured Allies and what it's doing to help solve that aging dilemma that you just mentioned.
Absolutely. And Assured Allies is a relatively new company. We've been around really only for the last 4 or 5 years. And it was started between two co-founders, one of whom was an MD and had spent much of his time in U.S. healthcare trying to solve population health management. And the other gentleman was a technology startup entrepreneur who had sold his company. These two guys came together and said, what is the most broken part of the US healthcare that we can help solve? And they settled into the long-term care space, essentially for two reasons. As you said in your opening paragraph, right? It is the most broken piece of the insurance spectrum, where we have people, when advisors identify consumers who want to buy long-term care insurance, the paradigm is so broken that 4 out of every 10 that want to buy it, who have the means to buy it, who have the interest to buy it, who put their hand up and say, I want it, currently can't buy the product. Insurance carriers won't take them. And so our co-founders brought together clinicians, researchers, data scientists, and actuarial science majors to solve what heretofore hasn't been solved, right? To figure out what are the pockets of opportunity where we can better insure people against morbidity, the quality of their life, not mortality, but the quality of somebody's life. And Assured Ally started doing that, working with in-force long-term care companies. And over the last 4 years, we've helped long-term care clients. We're currently working with 5 of the 10 largest long-term care insurers. And we've helped their aging clients age at home on their own, not living and moving into assisted living, but to stay and age in place where everybody wants to age, through what I would describe as small incremental wellness benefits, helping people figure out how to stay healthier at home. And we're just on the precipice of doing that with the NeverStop program as well.
Well, certainly one of the conceptions that I have about long term care is that it's generally not a great deal, it's generally too expensive. Is that consistent with what you see? And if not, what is the biggest misconception that advisors and their clients have around this issue?
Yeah, cost is an interesting question because is it a misconception? Maybe not. The products, many of the old school products, the old standalone long-term care products are not inexpensive. But we really ask a different question. And that different question is, if we know that 5 or 6 out of every 10 aging adults is going to need caregiving assistance, they're going to be users of long-term care services. The question is, how do they want to pay for that? Right? They can pay for it individually, and many companies, Genworth chief amongst them, runs the cost of care survey. We know that the average long-term care event for a client costs somewhere between $175,000 and $200,000 or more, depending on where they live. And the question is, what do you want to buy insurance for? And what do you want to self-insure? And that ties into what I would say is the biggest misconception, both for consumers and, I'm sad to say, for many advisors. And that is that many believe that Medicare pays for long-term care needs. And a poll that we ran not all that long ago showed that 60 to 70% of advisors and clients believe that Medicare paid for their long-term care needs. And it is completely wrong. As we know, Medicare pays for their medical needs. But the long-term care portion of it, Bob, this covers their activities of daily living, right? This covers them being able to get out of bed, to be able to get dressed, to be able to feed themselves, to be able to toilet themselves or shower. These are not things that Medicare covers. So even those clients who have Medicare will need to figure out how to pay for long-term care services. And what NeverStop is, what Assured Allies is trying to do, is to create products that allow consumers to determine how much care they want to buy. And even if it doesn't cover the full expected cost, let them put a policy in place that they can afford to help defer or deflect some of those anticipated costs.
Well, I am very familiar with this issue, having lost both my parents over the last 10 years, and I know what Medicare does and does not pay for. So, if the biggest misconception is not the expense, but where the money is going to come from, what role do advisors play in helping their clients understand that issue?
Oh my gosh, I think advisors play the primary role. Think about the role that our advisory community has done. They've done an amazing job in asset accumulation, right? They do a phenomenal job in assisting their clients in the spend down the income stage. Where's the right place to take money? Where do we want to take from first? What's the withdrawal rate? For those clients that have done well and protected some and have a wealth transfer opportunity, advisors do an amazing job in wealth transfer. And that really covers, for most clients, really covers those 3 stages, the key stages of their financial life. The one part that advisors are reticent to talk about is what they are going to do, what their clients are going to do if they have a long-term care event. We know currently somewhere between 4 and 5% of those over the age of 65 have a long-term care insurance policy. We also happen to know, as I said earlier, that somewhere between 5 and 6 out of 10, 50 to 60%, are going to be consumers of those services. So what is the role of an advisor? What is the role of providing holistic financial planning, if not to at least have the conversation with their customers, with their clients, about how do they plan to protect themselves in the event they have a long-term care need, and what is going to be the way they cover it. Many clients will choose, right, to self-insure. Many clients will say, look, if I need that money, if I need 5, 6, 7, 8,000 a month, I'll take it from my investment portfolio. And if that's the proactive choice that an advisor and their client makes, we're not in a position to say whether that's right or wrong. What we're suggesting, though, is that advisors have to at least have the conversation with their clients. And then if they decide to look at solutions, there are so many modern solutions that are out there. We all have heard about the annuity combo products, the hybrid where it's annuity and long-term care, or the life combos where it's life and long-term care insurance, where it's not a use it or lose it, right, scenario. There are so many modern versions of ways to cover that financial advisors would still be in the central position of helping advisors choose those products. And as an industry in the long-term care space, our goal is to help advisors play that key role by understanding the choices in the marketplace and helping their clients decide whether a product is the right way to go versus self-insuring.
You mentioned that the cost of care could be $5,000 to $7,000 a month. My experience was that it was 10,000 or more. Is that the implication to a consumer of doing nothing, or what is the implication?
Yeah, unfortunately, you know, kicking the can down the road implies that you are going to self-insure. And the question is, what does self-insurance look like, right? You either proactively purchase a product to cover the risk, or you are in essence relying on either your own income or income streams. And 10,000, by the way, is absolutely in line depending on where you live, certainly in the Northeast, where you and I happen to reside. 10,000 in an assisted living facility or a care unit is for sure in line. For those that start out in home care, there might be a less expensive version. But what doing nothing essentially says is either I'm going to rely and use my income, my assets, and wind those down, or I'm going to rely on family caregivers. And we know there are somewhere between 40 and 50 million family caregivers in the United States. These are people who are essentially providing care to their loved ones in an unpaid way. Maybe it's something, maybe it's not as a full-time aide. Maybe it's going over 2, 3, 4 days a week to do shopping, to help your aging parents do yard work, not providing help getting out of bed. But eventually, right, that full-time caregiving, that family caregiver in many cases has to make the decision between, do I stay with my full-time job? Do I continue to be a full-time employee somewhere and a full-time caregiver, right? Their position as the loved one, the child, the nephew, the niece, whomever, transitions for family caregivers in many ways into the primary caregiver role. And rather than spending their time with their loved one, enjoying their company, they spend those years taking care of them in a way they never envisioned. And unfortunately for many that choose to self-insure, that is the path that many go down, where they require their family members, their loved ones, to play a role that they never envisioned wanting. And that is unfortunately one of the outcomes of making no choice.
I'm actually surprised it's that low. I would have guessed that more than 40 or 50 million people provide some degree of a home care or health care for their parents. You mentioned the NeverStop rewards program earlier. What is that? How does it help address this issue?
So the NeverStop rewards program, which is currently available in one product that's out on the street through Equitrust Life Insurance Company, the product is called Bridge. The NeverStop Wellness Rewards Program essentially looks at people who want to stay as healthy as they can, and it incents them to make small incremental change to live a healthier life. Let me give you a little bit of an explanation on how it works. So somebody who buys the bridge annuity is welcomed into the NeverStop program, and they meet one-on-one with a health coach. These are coaches who work for Assured Allies. They're trained as health and wellness coaches. Standing behind them is a team of occupational therapists and physical therapists and clinicians. And these health coaches work with our policyholders and members to identify three of the 25 key areas of healthy living. These include things like cognitive strength, better sleeping, better hearing, better physical well-being, doing things like going for your preventative care, your doctor's visits. And through our health coaches, the policyholders, we call them never stoppers when they come into our program. Through this program, they meet with our wellness coaches. They identify which three areas of wellness they want to work on. Our coaches support them. They give them ideas, little tidbits on how they can make small incremental changes to hit their goal. Let's say, as an example, they want to work on their cognitive skills. Through our partnership, right, we can provide them with online resources. Every person who comes into our program gets a Fitbit device. So they get a wearable through the Fitbit partnership that we have, and through our partnership with Harvard Health. We have techniques and opportunities for them to take online classes, for them to take in-person classes. And as they complete these exercises, Bob, and they're changing, again, these small incremental differences, as they're doing that, we're rewarding them with real dollars that they can use for their long-term care needs if they need them. So think about it. They make a proactive choice to buy a policy that has a long-term care rider on it. So they're already protecting their long-term care needs. It's an annuity product, so it continues to in the market, and they can make as aggressive an investment choices as they and their advisor would like. But as they work with our health and wellness coaches, they're earning additional dollars that can be used for their long-term care needs down the road. And so we're helping people age better. We're helping them tackle the cost of long-term care services when they need it. And we're incenting them to live their best quality and healthiest life possible.
Has it been around long enough for you to do any studies to look at its efficacy to go back and see what difference it's made either in longevity or some other health metric?
Yeah, so the answer is yes, with an asterisk. So the program itself has been around only for 13 months. And through 13 months, we've got about 70% of our members who have purchased the Bridge product have been enrolled in the NeverStop Wellness program. It's voluntary, so some choose to not do it. The program itself was built and the efficacy driven by the earlier business I described, where we're working with in-force long-term care clients. We took and modeled our NeverStop program on what we call our Age Assured program. And that Age Assured program has shown for the clients that we're working with an 18% reduction in claim cost for the insurance carrier. So in essence, we've bent the age curve for the carrier and saved them over 18% of their long-term care claims expenses. So it hasn't been, the NeverStop program hasn't been around long enough for us to point to those type of results. But we certainly, because we modeled both the program and the clinical efficacy based on this other program, we believe that we can help consumers easily save anywhere from 15 to 20 to 30% of expected costs for claim, which is their money, by the way, right? This allows them to defer and use that money later at some point. And so we do have a correlation to efficacy.
So you're basically disrupting the long-term care insurance industry by providing this incentive in this program to lead people to live healthier lives. Is that what the future of long-term care insurance looks like? Or if not, what is the future?
Yeah, I think it is the beginning of the future, right? I think it's impossible to predict what innovation looks like 5 and 10 years down the road. What I can tell you, we built, I didn't even mention this, we built this product. Everybody who applies, there is a 100% medical guarantee of purchase. Even somebody in a nursing home that wants to buy the bridge product will be medically guaranteed acceptance to buy it. So that's first and foremost, right? And that's through innovation. Underwriting used to be measured for long-term care insurance, Bob, you may know, used to be measured in weeks and months. You'd put a policy in, right? You'd put an application in, it would take an insurance company 4, 5, 6, 8, 9 weeks to make a decision. And again, 40% of the times they'd come back and say, nope, we're not interested. The bridge product through our Assured Allies innovation is both medically guaranteed and the underwriting is done in less than 30 minutes, period. Every person is decisioned and guaranteed acceptance inside of 30 minutes. That's the type of innovation we're looking to reduce the friction for advisors and their clients. We want to make insurance, long-term care insurance, affordable and attainable for every person that wants it, because what we know is this curve of aging adults, 65 and older, we know for the next 10, 15, 20 years, the impact that that is going to have on both insurance carriers, on people's financial security, on the cost of services for baby boomers and their children and family that have to take care of them. And our goal, and where we see the innovation in the future, is making products more attainable, helping people manage their own cost, their out-of-pocket cost, by giving them opportunities to purchase pieces of coverage, if not all of the coverage. And it's an exciting time in the industry because we get to use artificial intelligence and data science to really predict aging in a way that we've never been able to do in the industry before.
Given where the long-term care insurance industry is now and the pricing that exists, are there any clients that you think are good candidates for that insurance, and how should advisors go about determining whether a given policy is appropriate and cost effective?
Depending on the financial needs of the client, there are products available in today's marketplace for virtually every client out there. Somebody from 45 and 50 years old that traditionally has thought of themselves as too young for a long-term care product, considering most people don't actually need the policy to pay until they're in their late 70s or early 80s. That's where some of these annuity hybrid products come in. It allows an advisor to control how much how much of somebody's assets do they want to run at accumulation, and how much of it do they want to run towards protection, towards a long-term care. There are life combo products that we've seen that also allow somebody to figure out how much protection, how much death benefit protection versus how much long-term care, how much morbidity protection. And then there are products that go all the way to the extreme, the standalone long-term care products, which are the ones that most people think of as too expensive. What I would say is that given the new product innovation, given the way companies like Assured Allies are attacking the friction in the product and the pricing in the product and trying their best to push innovation through, what I would really recommend for advisors is to educate yourself as best you can. There are products out there that will lend themselves to the conversation of how can we protect you, Mr. and Mrs. Clients. I remember a conversation I had with one of my best clients when I was an advisor early in the 2000s. And while the conversation may be old, the issue is as current as could be. And this person, my client, passed away. And unfortunately, they passed away after they had needed long-term care services. And their portfolio, or what their beneficiaries had thought was going to be a rather large portfolio, had been eroded due to long-term care needs. And it doesn't matter how much they had or how much what was left. But what I had to do was explain to the beneficiaries why their parents had never been talked to about long-term care insurance and the protection of their assets. And I had just inherited the client. I was new in the program and didn't really have an answer. but I would urge financial advisors today to at least look at the products that are out there, have that conversation with your clients about how do they want to cover these needs, and educate yourself on all of the products that are out there. If you're interested in our product, there's certainly, you can go to NeverStop.com, you can go to AssuredAllies.com. If you're working, if you're an independent agent and you're working with an IMO or a BGA, reach out to your insurance upline. There are plenty of ways to get current, but do yourself a favor and take another look. There are products out there today, are innovative, they're helpful. The goal of the industry is to provide a solution for everybody that needs or wants coverage, and the products are out there.
And we'll include those links in the notes that accompany the podcast. If there's one key takeaway that you would like to leave with our audience of advisors about how they can help their clients hedge against the risk of poor health and its associated financial consequences, what would that be?
Yeah, I think the one key takeaway is we all hear about wellness. The wellness is the big catch basin that we hear, whether it's financial wellness, whether it's physical wellness, whether it's cognitive wellness. What I would suggest the key takeaway is help your clients be proactive in all of their planning. Don't get caught up in the catchphrases. Do the work to figure out how I can help my clients live their best version. There are products out there that offer these incentives for your clients to live their healthiest life. And that's the key. It is not about extending mortality, although that would be wonderful. That's what modern medicine is for. The key for us is how do we make their time on this earth the best possible, the highest quality for them, and look for products, look for services that enrich and enhance your clients' well-being and their morbidity. And if you can do that, we're going to provide all of the wellness, both financial, mental, physical, cognitive wellness that we can, and give your clients the best version of themselves.
Those are great goals. And we'll include some links where you can get more information about Larry and his team at Assured Allies. There'll be a link to the Assured Allies homepage and to the NeverStop homepage. Larry, is there anything else you'd like to add?
I absolutely want to say thank you, Bob. I can't tell you how much I appreciate the opportunity. Thank you to Advisor Perspectives and to Vetify for having me. I really applaud what you guys are doing, and to your audience for listening and participating. And I'll look forward to connecting with you guys again shortly, I hope.
Well, you're welcome, and thank you for listening to the Gaining Perspective podcast with Bob Huebscher, today featuring Larry Nisenson of Assured Allies. To support our podcast, please share, subscribe, or leave a review to help make our podcast more findable for your friends and colleagues. You can subscribe to Gaining Perspective on your favorite podcasting service.